We are continuing our breaking news coverage here on NBC News Now. If you're just joining us, to recap here, former President Biden, we've learned, has been diagnosed with prostate cancer, according to a statement released by his personal office just in the last 5-10 minutes here. They say the diagnosis was made on Friday, and they call it a more aggressive form of the cancer. They do say it appears to be hormone sensitive, which allows for effective management. The former president is 82 years old. He is apparently, we understand, in Wilmington as he and his family are reviewing treatment options now. I want to go to our White House correspondent, Yamiche Alcindor, who is joining us now from the White House. What else do we know, Yamiche?
Well, we don't know much else other than what you just laid out, which is that the former president is now dealing with prostate cancer. I've been talking to a source familiar with the president's thinking as well as his family's thinking, and they tell me that he's meeting with a number of doctors and considering multiple treatment options. They also tell me that the cancer that he has seems to possibly be effective at being treated with hormone therapy for cancer, though, as I said, a number of treatment options here are being looked at. Of course, the president has been facing a lot of scrutiny and had been facing a lot of scrutiny at the tail end of his term, with some saying that he was looking not as healthy, with his cognitive issues also being questioned. But now we have this sad news of the president having prostate cancer. We are also seeing lawmakers already starting to send prayers to President Biden, who, of course, had a decades-long career in politics. So a lot of people in D.C. are saying that they are really thinking of the president, praying for the president, and hoping for the best, Hallie.
Yamiche, I'm going to ask you to stand by for just a moment. Our Meet the Press moderator, Kristen Welker, is joining us now on the phone. And Kristen, we had heard just within the last week that the former president, had had a small nodule found on his prostate, according to a statement his office released not even 5 days ago. Kristen.
Hallie, you're absolutely right. And now the world receiving this news about the former president. I was just in touch with one former Biden aide who said this news is devastating, incredibly sad. They are sending prayers to the family. Hallie, this aide also said former President Biden is one tough guy, and this person expects him to pull through. And so that, I think, is going to be consistent with what you hear from his allies, from those who have worked with him, as Yamiche just laid out. This is someone who has a long, long career in Washington politics, and certainly someone who is no stranger to tough battles, but undoubtedly this is a battle of a different kind. And so we await official reaction from the White House. And of course, this does come at a time, politically speaking, when there had been new revelations about President Biden, his mental acuity when he was in office, this new book that is coming out in a matter of days. I was just speaking with Senator Chris Murphy of Connecticut on Meet the Press and asked him if Democrats should have acted sooner to encourage the former president to drop out of the race. He said, yes, effectively, that it was a mistake that he didn't drop out sooner. And so those complicated political headlines intersecting with this really difficult medical news for the former president, and undoubtedly this medical news will likely take center stage now as Democrats and, quite frankly, people all across Washington hope that he is able to recover from this, Hallie.
Kristen, I wonder if we can talk about the timeline here. Former President Biden has been out of office just about 6 months now, of course, January 20th, Inauguration Day. The personal office of his says this cancer was diagnosed specifically on Friday, presumably, although we don't know this for sure, after that further examination that you alluded to when they found that nodule on his prostate at the time, believed to be something fairly common, now characterized as more aggressive. A former president, any former president, would have access to the highest levels of medical care in this country, right?
You're absolutely right, Hallie. And so there will be questions about to what extent was he getting medical care in those final days that he was in office? Was this something perhaps that could have been determined sooner? Those are the types of questions we are not able to answer at this moment. But I think that your point is the important one, which is that he has access, and as president certainly had access to the highest level of medical care. And so what happens now? His family is reviewing their treatment options. Yeah. This is a family that is incredibly close, Hallie. I think it's a moment to remind people that former President Biden has lost 2 children throughout the course of his lifetime, including his precious Beau Biden, who passed away of brain cancer several years ago. And so this is a family that has been brought close together because of some of the trials and tribulations that they have experienced together. And so they are undoubtedly approaching this new medical challenge, I should say, in the same way, pulling together as a family, trying to determine what their next steps will look like and how they are going to get through this together as a family, Hallie.
And as you know, Kristen, it is not just the family, of course, rallying around their patriarch, if you will. We have seen already now reaction from members of Congress, from the people who served alongside former President Biden when he was on Capitol Hill, not far from where we're sitting, for so many years.
Absolutely. And I think this is one of those moments that you are going to see people come together in a bipartisan way, Hallie. You're going to get reaction and support, quite frankly, from both sides of the aisle. This is someone who had a good working relationship with Democrats and Republicans. Yes, there were fierce political disagreements and fights and arguments, but he also was able to tout the fact that he did, particularly given his decades-long service in the Senate, establish strong relationships with Democrats and Republicans alike. So I anticipate what we are going to see from this moment forward really is a bipartisan outpouring of support for the former president, for his family, as they continue to assess what their next steps and next options will be moving forward as a family, Hallie.
Kristen Welker, our Meet the Press moderator. Kristen, thank you so much for calling in as we are covering this breaking news here on NBC News Now. I appreciate that. Let me bring in now NBC News medical contributor Dr. Kavita Patel, who is joining us now. Dr. Patel, we're glad to have you. She's on the phone. And can I read you here a piece of this statement from the former president's personal office in which they describe this prostate cancer as having a Gleason score of 9, grade group 5. Can you put that into plain English for us? What does that mean?
Yeah, Hallie, so this Gleason 9 is a high-grade prostate cancer score. It's a scoring mechanism that we use to just try to kind of indicate and differentiate what are considered normal prostate cells and those that are likely to grow and spread quickly. The higher the number, the worse the score. And the way you get that kind of grade, and the highest that you can see is 10. I would read into that, at least for the president's prognosis, because that's the next question everybody's asking, is that it sounds like it's hormone sensitive. So it would be put into the category of a prostate cancer that is aggressive, and that when the pathologist looks under the microscope, that the cells do not look like normal prostate cells. That's kind of what the Gleason 9 tells us, that pathologists are looking and they see that the cells just don't look like normal cells, and that this is a type of Gleason. That score correlates to a very aggressive form of cancer that can, as we see with the president, who I imagine has gotten regular prostate screenings, can crop up rather quickly. Then on top of that, Hallie, we look at whether it's hormone sensitive. That means that some cancers can respond to hormone treatment. In this case, from what the president has released, it sounds like it is. That's good. But in general, this aggressive form of cancer, this high of a Gleason score, is concerning.
And the fact that it has metastasized, it appears, to the bone, Dr. Patel?
Yeah, so we can see people with metastasis, meaning there's kind of localized cancer where there is no other cancer cells detected anywhere else than the prostate. But we can also see regional or metastatic cancers that can respond to therapies, especially if they're hormone sensitive. But in general, with this kind of pattern, and the president is a very healthy individual, but just the age, the pattern, the combination, it just adds to a complicated diagnosis. What I suspect we will hear more in the coming days is kind of what the treatment plan is. That could be anywhere from, surgery combined with therapies. And then we're looking at trying to understand, what 5 and 10 year survival rates are based on what his doctors put together for a treatment plan.
You mentioned these particular hormone therapies here. Would chemotherapy be an option? You mentioned surgery could be an option. Obviously, I'll do the caveat. You don't treat, of course, former President Biden, Dr. Patel, but just from your expertise in the medical field, what would that menu of options look like moving forward?
Yeah, so the menu of options, first of all, especially depending on kind of what that cancer looks like and what they deem, they might decide. And also, by the way, how problematic the symptoms are. This started with what sounds like some urinary symptoms that prompted him to get checked. So there might be a combination of surgery, there might be radiation therapy, and then chemotherapies and hormone therapies kind of all combined. So you can see this with cancer, kind of a multimodal approach. And it just depends on how, especially with cancer that they found in the bone, it just depends on the sequence that makes the most sense for the type of cancer the president has. So what I want people to take away from this is that the president is probably one of the most, lucky individuals in terms of access to medical care. I have no doubt he's getting comprehensive medical care, but he is going to likely be going through some very rough days with his family to just make decisions based on what doctors are talking to him about.
Dr. Patel, before I let you go, if former President Biden had been getting these regular prostate screenings, is it abnormal for something this serious to creep up this quickly?
It's not, but it does indicate, Hallie, that this is one of those really aggressive types of cancer. So when we started the conversation with that Gleason 9, and I mentioned that on a score of 1 to 10, that shows you how abnormal the cells are, that usually also indicates a rapid kind of aggressive growth appearing cancer. So it's not that unusual. Unfortunately, it's also not that common. So it's something that we're going to have to keep an eye on. And certainly my heart goes out to his family and much of the world who's probably kind of hanging on to understand more details.
Yeah, Dr. Kavita Patel, thank you very much. I want to go back to our Meet the Press moderator, Kristen Welker, who is with us again on the phone. And Kristen, I understand you have some new reporting.
We're tracking reaction from lawmakers, Hallie, and I'll just share some of it with you, what we have so far. Democrat from Ohio, Greg Landsman, says, our prayers are with the Biden family. Sarah Jacobs, Democrat from Michigan. I'm incredibly saddened to hear of President Biden's prostate cancer diagnosis, but anyone who knows him knows that he's tough as nails. I'm praying for a swift and full recovery. Representative Verona Escobar, Democrat of Texas, saying, sending my prayers for health, strength, and a speedy recovery to President Biden, who I know will be surrounded by his adoring family during this challenging time. And Hallie, I just go back to that central point, which is this is a former president who's incredibly close to his family. He's huddling at his home in Delaware right now as they think about next steps, what his options will look like. That's the first tranche of reaction that we're getting, Hallie, but I anticipate we're going to start hearing from lawmakers on both sides of the aisle, as well as world leaders. Given the fact that he was in the Senate for decades, he served 4 years as president. This was someone who had relationships with people all across the world. So that's the type of reaction we would anticipate we would start to get in the coming minutes and hours.
Kristen Welker, thank you. Let me go back now to Yamiche Alcindor, who's live for us at the White House. And the current president, of course, President Trump, is freshly back from his trip overseas to the Middle East, Yamiche. I don't believe we've heard anything from this White House yet, but would that be perhaps an expectation moving forward? Do we know?
That is an expectation at some point that the President Trump, as well as the White House, will put out a statement. We know, of course, that President Trump has been very critical of former President Biden. But this, of course, now becomes personal when it comes to the fact that, of course, the former president is battling this aggressive form of cancer. And I've just been talking to someone who's close to the Biden family who tells me that he is resting right now at his home in Wilmington, Delaware, a place that he's loved to go, that he went very often during his weekends when he was here in the White House. That person says it's unclear where ultimately the former president is going to be treated. But again, they're looking at their options. It is, again, something that we're going to try to continue to watch when it comes to this current White House's statement here. While the President Trump has had this really tough relationship with President Biden, very critical of him. We expect him, like so many other people in Washington, D.C., to send prayers, to send good thoughts, to send his heart out to this family that is now really dealing with news that no family wants to deal with on this Sunday, Hallie.
Yamiche Alcindor live for us there at the White House. Yamiche, thank you very much. Our thanks to Kristen Welker, to Dr. Kavita Patel as well, who joined us for this NBC News special report. We will, of course, have much more ahead, not just on NBC News Now, but coming up tonight on Nightly News. I'll see you then, as well as online at NBCnews.com. I'm Hallie Jackson. For all of us here at the network, thank you for watching. We'll see you soon.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.